Hello everyone. Today we're going to talk about a condition called hyperthyroidism. Think of your body like a car engine. Normally it runs at just the right speed to get you where you need to go. But what if that engine started revving much too fast, even when you're just sitting still? That's a bit like what happens with hyperthyroidism. It's a medical condition where your thyroid gland, a small but very important gland in your neck, starts working overtime. This little butterfly-shaped gland produces too much of its hormones, which are called thyroxine, or T4, and triiodothyronine, or T3. These hormones are responsible for controlling your body's metabolism, which is the speed at which your body uses energy. So, what does this overproduction of hormones actually do? Well, when your thyroid gland releases too many of these chemical messengers into your bloodstream, it essentially puts your body into a state of overdrive. Every single process in your body speeds up. Your heart might beat faster, you could feel unusually warm, and your mind might race with anxious thoughts. It's as if someone has turned up the thermostat and the accelerator on your body all at once. This constant high-energy state can be exhausting and can affect nearly every part of your body, from your brain and your heart to your skin and your bones, making you feel quite unwell over time if it is not managed correctly. It's important to understand that hyperthyroidism isn't just about feeling a bit energetic. It is a genuine medical issue that requires proper attention from a doctor. The condition can affect anyone at any age, although it is more commonly seen in women than in men. The effects can range from being quite mild, perhaps just feeling a little jittery, to being very severe and causing serious health complications. The good news is that once it's identified, there are excellent and effective treatments available to help get your body's engine running at the right speed again. The first step is always recognizing that something isn't quite right and seeking medical advice. We can classify hyperthyroidism based on what is causing the problem in the first place. One way to look at it is whether the issue starts within the thyroid gland itself, or if something outside the thyroid is telling it to work too hard. This is often described as primary versus secondary hyperthyroidism. In primary hyperthyroidism, the thyroid gland itself is the source of the problem. It's independently overproducing hormones. In secondary hyperthyroidism, the pituitary gland in the brain is sending too many signals to the thyroid, pushing it to make more hormones than the body actually needs. Understanding this distinction is very helpful for doctors to decide on the best course of action. So, what causes the thyroid gland to go into this hyperactive state? The most common cause, by a long shot, is an autoimmune condition called Graves' disease. In a healthy person, the immune system creates antibodies to fight off infections. However, in Graves' disease, the immune system gets confused. It produces an antibody that mimics the signal from the pituitary gland, tricking the thyroid into constantly producing hormones. It's like a key that gets stuck in the ignition, keeping the engine running non-stop. This condition often runs in families, so if a close relative has it, you might have a slightly higher chance of developing it yourself. Another common cause is the presence of thyroid nodules. These are little lumps or growths that can form on the thyroid gland. Most of the time, these nodules are completely harmless and don't cause any issues. However, sometimes these nodules can become hot or toxic, which means they start producing thyroid hormones all on their own, separate from the rest of the gland. When you have one of these overactive nodules, it's called a toxic adenoma. If you have several of them, it's called a toxic multinodular goiter. These nodules essentially act like rogue mini-factories, churning out extra hormones and disrupting the body's delicate balance. A less common but still important cause is a condition called thyroiditis. The itis part of the word means inflammation. So, thyroiditis is simply an inflammation of the thyroid gland. This inflammation can happen for several reasons, such as after a viral infection or sometimes after pregnancy. When the gland is inflamed, it can leak the hormones it has stored up into the bloodstream. This leakage causes a temporary period of hyperthyroidism. Unlike Graves' disease, this type of hyperthyroidism usually gets better on its own over a few weeks or months as the inflammation settles down and the gland heals itself. Now let's talk about what happens inside your body, which we doctors call pathophysiology. The thyroid hormones, T4 and T3, act on almost every cell in your body to regulate metabolism. When you have too much of them, your basal metabolic rate skyrockets. This means your body is burning through energy or calories at a much faster rate than normal, even when you're resting. This increased metabolism affects your cardiovascular system, causing your heart to beat faster and more forcefully. It also affects your nervous system, making you feel more alert, anxious, or irritable. It is this widespread systemic effect that leads to the many different symptoms people can experience. Because hyperthyroidism speeds everything up, the signs and symptoms can be quite varied and affect you from head to toe. You might notice some significant weight loss, even though you are eating more than usual. This happens because your super-fast metabolism is burning calories so quickly. You may also feel constantly hot and sweaty, as your body is generating excess heat. Many people experience a tremor, which is a fine shaking, usually in their hands and fingers. You might also notice your heart is racing or pounding in your chest, a sensation known as palpitations. It can feel quite alarming, as if you've just run a race when you've only been sitting down. Beyond the physical feelings, hyperthyroidism can have a big impact on your mood and energy levels. You might feel very anxious, nervous, or irritable for no clear reason. It can also be difficult to sleep, leaving you feeling tired but wired at the same time, which is a very frustrating combination. Some people notice changes in their bowel habits, often needing to go to the toilet more frequently. For women, menstrual cycles can become irregular or lighter than usual. You might also notice that your muscles feel weak, especially in your upper arms and thighs, making it difficult to climb stairs or lift heavy objects. It's a condition that truly affects the whole person. If you have Graves' disease, you might also experience some very specific symptoms related to your eyes. This is known as thyroid eye disease or Graves' ophthalmopathy. You might feel like you have grit in your eyes, or they may become red, watery, and sensitive to light. A key sign is when the eyeballs seem to bulge forward, which happens because the tissues and muscles behind the eyes become swollen and inflamed. Your eyelids might also pull back, giving you a staring appearance. It's really important to mention any eye symptoms to your doctor, as they may require special attention and treatment from an eye specialist. So, if you're experiencing some of these symptoms, what happens next? The first thing your doctor will do is have a good chat with you and perform a physical examination. They will feel your neck to check if your thyroid gland is enlarged, a condition known as a goiter. They will also check your pulse for a rapid heart rate and look for any tremors. To confirm the diagnosis, the most important step is a simple blood test. This test measures the levels of thyroid hormones, T4 and T3, and thyroid-stimulating hormone, or TSH, in your blood. In hyperthyroidism, T4 and T3 levels are high, while TSH is usually very low because the pituitary gland has stopped sending signals to an already overactive thyroid. Once a diagnosis of hyperthyroidism is confirmed, the great news is that there are several very effective treatment options available. The choice of treatment will depend on your age, the underlying cause of your condition, and your overall health. The first line of treatment is often medication. There are medicines called antithyroid drugs, such as carbimazole or propylthiouracil. These work by directly blocking the thyroid gland's ability to produce new hormones. It can take a few weeks for them to start working properly, but they are very good at bringing your hormone levels back down to a normal range and relieving your symptoms. Another common and highly effective treatment is called radioactive iodine therapy. This might sound a bit scary, but it's a very safe and well-established procedure. It involves taking a small dose of radioactive iodine, usually in a capsule or a drink. The thyroid gland naturally absorbs iodine from the blood to make its hormones. So, when you take this dose, the radioactive iodine is taken up by the overactive thyroid cells. The radiation then slowly and safely destroys these cells over a period of a few months, reducing the gland's ability to produce hormones. This treatment is very targeted and doesn't harm other parts of your body. In some situations, surgery might be the best option. This involves an operation to remove all or part of the thyroid gland, which is called a thyroidectomy. Surgery is often recommended if you have a very large goiter that is causing discomfort or difficulty swallowing, if you cannot tolerate the medications, or if there is a suspicion of thyroid cancer. After surgery to remove the thyroid, your body can no longer produce its own thyroid hormones. This means you will need to take a daily hormone replacement tablet for the rest of your life to maintain normal body function, effectively curing the hyperthyroidism but resulting in hypothyroidism. In summary, hyperthyroidism is a condition where the body's engine is running too fast due to an overactive thyroid gland. It can be caused by conditions like Graves' disease or thyroid nodules, leading to symptoms like weight loss, anxiety, and a rapid heartbeat. Thankfully, a simple blood test can diagnose the issue, and there are excellent treatments available, including medication, radioactive iodine, and surgery. Early diagnosis and proper management are key to feeling better and preventing long-term health problems. If you think you might have symptoms, please don't hesitate to speak to your doctor. They are there to help you get your body's engine running smoothly once again.